supply and demand narrative. We can't expect that one...
Kasi at the very least, they understand what the government is trying to do.
And maybe help the government understand what they're trying to do also.
Okay.
In one more elegant.
Hello and welcome to EMDRCM Live special episode. This is an outreach of the Executive Master in Disaster Risk and Crisis Management of the country's premier graduate school for business and management, the Asian Institute of Management. We are live streaming from Makati City, and we are safe and healthy and still recovering from the initial shock of last night's announcements from the President, and to also share with the rest of you how the AIM community is taking that announcement. We have a couple of videos that we took about the people in our community.
Oh, siyempre naman, nag-alala rin ako. Siyempre kahit pa paano kalusugan natin yan. So, nag-alala pa rin ako. Then, ang maganda lang dyan, keep safe at keep always healthy and always pray. Hindi, ang magandang magawa natin ay umiwas tayo sa maraming tao at saka if possible, always na maglalagay tayo ng yung mask. Yun lang.
Para sa akin, wala naman masyadong though yung nag-iingat din naman, pero hindi naman ako sobrang yung kumbaga nagpapanik tungkol sa mga nangyayari. Siguro sundin lang yung mga madalas naman na sinasabi ng mga doctors, gagaya ng paglilinis ng mga kamay at saka yung paggamit ng mga sanitizer, alcohol, ganun. Siguro yun lang naman.
Actually, this is the first time that I am experiencing it. And of course, we feel there's panic and nervous at the same time. For my family, especially my mom, I have to calm her down because at her age, she is sickly, and right now she's the one who panics the most. So all I have to do is assure her that this too will pass. But for now, all I have to do is, tell her that it's going to be alright.
Sa akin po, okay lang. Maganda naman yung gano'n na para hindi kumalat. Yung halimbawa na nandito sa Metro Manila na hanggang dito na lang huwag mo makapunta sa mga probinsya. Sa akin po, huwag mo nang lalabas ng bahay, pamilya, yung mga anak ko. Huwag ganong pupunta po sa kanya. Dapat sa bahay lang.
Well, I'm Car Testa, and I'm the interim head of the School of Executive Education and Lifelong Learning. I've been an adjunct faculty for the last 10 years as well here in AIM, and before that, I might be what you would call a career consultant, basically consulting in SGV, Anderson Consulting, and Accenture. Yes, the less chances of exposure, and the tough challenge there is people who are actually infected don't even know it. I think one is we need to support that and then find ways to work. I mean, in terms of, while lessening contact, actual physical contact with people. So like what we're doing in AIM is actually moving our programs to online learning as quickly as we can. They may not be perfect at this time, but we will do the best we can and improve along the way.
We'll also share a quotation from our Dean and President, who also managed to share with us how she took the announcement from the President. We should not panic. We should do our best to stop the spread of the virus. We need to respect the policy guidelines we are receiving. We also need to follow instructions on how to wash our hands, how we maintain our social distance, and do not participate in organized mass gatherings. There are a lot of simple steps we can take to delay the virus from spreading. So coming from the reaction of the AIM community, the random people we were able to talk to this afternoon, panic is one of the common things that we're hearing. And it's understandable because this is, again, a first time that we're doing such a thing. That brings us to the very important topic for this special episode of EMDRCM Live. We're trying to make sense of this particular crisis and looking at innovative thinking to overcome COVID-19. And to help us understand, go through the complexity of this crisis we're facing is our favorite guest at EMDRCM Live. And I'm a student. And as a student, you don't know a lot of things. So you rely on the professors to guide you in the way that you think and process the information you get. So to help us navigate through the complex things that we're hearing and absorbing, our friend for EMDRCM Live and our professor for EMDRCM, Professor Richard Cruz.
Hello, good afternoon, everybody. I hope you're having a not too stressful Friday evening. So, Wally, thank you. I just want to say hello to all those who are listening. And I'm very happy to be with you this afternoon to share my own thoughts and how I process so far what's been happening the last several days about COVID-19 and the government's response.
Right. And if you notice, we've made a lot of improvements in our sounds. So hopefully we don't encounter the problems we had the first time we had Professor Cruz here. So those of you who have questions or comments about what we're trying to discuss this afternoon, please share them through the Facebook page. Keep them coming, and we'll find time to try to address some of them. So going to this topic, Professor Cruz, let's try to understand first, what do we actually mean when we say overcome COVID-19?
Okay, so, when you say overcome COVID-19, of course, there's a lot of uncertainty around that. We can try to see what we already have experienced in the past. Okay, so the most common ways of understanding trying to overcome could be compared to the past outbreaks of coronavirus, novel coronaviruses such as MERS-CoV and SARS, and understanding how they also began and how they spread. Okay, so there's some comparison there. And of course, because of what we've experienced in the past, we do take a lot of hope that this too shall end and that we will all be okay afterwards. Okay. However, I think there's some unique characteristics of this particular virus. So I'm not a medical practitioner, but my understanding is that it seems to be fairly communicable, and the mortality rate seems to be relatively higher than other types of.
It's actually the fatality rate for COVID-19 is lower than MERS and Ebola and SARS, but again, because of this day and age where information gets spread too quickly, I'm not particular about the data, but the spread of this disease is alarming, but the fatality rate is not as high as those that you mentioned earlier.
Okay, so we will find that out for sure eventually, maybe when this is over, because right now the challenge really is, do we really know how many people are infected by the virus, and is the data reliable at this point, and are the calculations and estimates correct? So I think there's some working numbers, okay? So, but I think eventually when this is all over and we get the final tally, then we'll really understand the real impact of the virus.
Right.
But I think what we know in relation to what has happened in other countries in relation to COVID-19 is that, if we just try to understand what are the good practices or the best practices, I would say that there are several countries right now that are kind of ahead of us in terms of the spread, okay? And of course, China is ahead. It seems like they're already on a downward trend. And most of the analysis that I've listened to in relation to China has been two things. Number one, they really try to slow down the spread using their very vast powers to limit travel within Wuhan, within the province. So very authoritarian, I would suppose, coupled with massive resource investments in personnel. So they brought in tens of thousands of medical personnel into the afflicted areas. They rapidly invested in new hospitals. So they demonstrated that they could actually build
10 days.
a new working hospital in practically a week. Okay, so I would say that if you look at what China did, you can really divide it into two parts, right? One is to slow down the infection rate, and then on the other hand is really to ramp up their capabilities to address it. So because it's novel, the medical system has to understand how the disease affects people and how it can be treated, if it can be treated at all, and what are the implications of that. So I think it's really in those two areas. If you look at the second country like South Korea, I would say that maybe they did more on the ramping up of the capability. So they did massive testing. They
They made it more accessible, but you don't have to go to the hospital.
Yeah, there was like drive-through. So they had innovations like the drive-through testing, a lot of information, a lot of great tracking on that side. So it seems also that they're also the other country now that's on a downward trend when it comes to this virus. Okay. Now, if you look at other countries that are, I think, still on an upward trend as of today, you can say Iran and Italy. It seems like, number one, maybe they were a little delayed based on the reports that we've been hearing. They've been a little delayed on the surveillance and a little delayed on slowing down the spread. Okay. So for us, I guess the outcome, what we want is really to overcome COVID. And, I think first of all is we should really focus people on the outcome. Okay. And I think the outcome that we're really looking for is that, we want to come out of this as a stronger country. We want to come out stronger, not just physically. Of course, we want to be healthy, but stronger mentally, stronger emotionally, stronger socially. We want to come out of this smarter, and we want to come out of this more resilient. Okay.
Professor, when we come out of this particular crisis situation intact, it also creates a lot of confidence to the Philippines, right?
Yes, yes. And I think what we're trying to do today in this live stream is to say that the first thing that all Filipinos need to agree on is the outcome.
Right.
I think that's the starting point. So we want to focus all of our varied efforts to the same outcome.
And we verbalize it through this slide. We want to come out stronger, healthier, more resilient. So what Prof. Cruz mentioned earlier is trying to also push us into that narrative.
Yeah,
what
I think
we're trying to do
yeah,
is...
I think in the future, because we know how to wash our hands. So, I saw some posts from some friends who are nurses in different hospitals. They were clapping their hands saying that finally Filipinos have learned to wash their hands. Okay, so if we continue to carry that after this event, for sure we will become a healthier country. Stronger simply because, I think just going through the challenges of this together, we will become stronger, the ties will be stronger. And hopefully also, we will understand that the way we design systems in the future, our healthcare system, and so on and so on, the system of our economy can be designed in a more resilient way so that we don't get as hard as we are getting hit right now because of cancellations in travel, postponements in events, or reduction of socialization, etc. So we know that in the future, we will become more resilient.
So that's where we're coming from. We identified where the end state ought to be. Now, Professor, it's also possible that at the end of this, we don't end up stronger, we don't end up resilient, we don't end up healthier.
That's true. I mean, of course, if the collective effort of society is perhaps not focused on the outcome, and maybe they're focused on different things, then maybe despite all of the resources and energy that we will invest, it's possible that it might happen. Of course, so that we really need to make sure that we provide the right vision and the right leadership and the right mindset so that all decision makers everywhere across the board, whether private sector, government, NGO, developmental organization, all of our leaders has an ability to reframe what's happening today, because obviously what's happening now is very novel. I don't think there's any basis in the past that is a good basis to pattern our decision making. So we need to take a fresh look. So the challenge really is to talk to one another, listen to other points of view, reframe the issues, and be quite flexible in terms of designing new products and services, new structures, new policies, and being more willing to challenge old assumptions.
Okay, got it. You mentioned about leadership. Let's go back to what was mentioned in last night's press conference by President Duterte. Okay, so we will not present to you the entire transcript of this press conference, but we have put down some list of the things that, key points that we fished out from that transcript. The code alert system for COVID-19 is raised to the code red sub-level 2, the highest level. The imposition of social distancing is in effect, so we are being asked not to go into gatherings a meter of at least 3 feet from other people. Suspension of classes in all levels in Metro Manila until April 12. This one, again, about social distancing, prohibition of mass gatherings that would impact the way that the local governments are able to respond. The community quarantine, which will take effect in Metro Manila, they prescribed when to call for it and who is in charge of actually declaring one for the barangay, for municipalities, and for the provinces. And then also this one, which I guess is creating a lot of questions in the minds of people. Land and domestic air, domestic sea travel to and from Metro Manila shall be suspended beginning Sunday until April 14th. So that's a month from March 15. So all of this prescriptions from the government, we were talking about one part of addressing this particular virus, and you were using an economics model to explain that.
Well, I think
so. All of this is all about preventing the spread.
Yeah, I think when you look at this interagency task force recommendation that was accepted by the president and will eventually be converted into an executive order, and then there's going to be implementing rules that will be developed and used by different agencies. I guess the first way to ask, or the first thing we should ask is, is it sufficient? Okay, is this whole thing sufficient?
Wait, let's clarify that. Is what sufficient?
Is this plan sufficient to overcome COVID-19? Okay. So the question is, do all of the elements here, will it lead to, at the end of, let's say, 1 month, because that's the time that they're giving, right, 1 month, will we actually be rid of COVID-19 by April 14?
Rid meaning no other Filipino gets infected.
Well, that's the hope, right? So, of course, they did say that they will evaluate on a daily basis the status of the city of Metro Manila. But the real question is, but since they already put into place an initial time frame of 1 month, the question is, what do they really expect to happen in 1 month? Okay. And if you ask me, my own opinion, based on my understanding of these guidelines, is that what this is really pushing, I think, is just really one of the big aspects of the issue. Okay, so many of the policy guidelines here are, for me, it's really about reducing people's exposure to the virus. Okay, so it's really about reducing their exposure to the virus. And so if you look at the key points, right, it's really, number one, ensuring that Metro Manila is separate from the rest of the Philippines. Okay, so for me, that first set of policies about land travel and sea travel and air travel between Metro Manila and different points of the province, and that being halted more or less for 1 month, says that, okay, that's the first intention. We need to isolate Metro Manila as its own community. Okay. So that's the first isolation. That's the first avoidance of risk. The second one is really the social distancing. Okay. So what that means is we really shouldn't be this close to one another. We'll get a wider lens in the future. Okay. So, but the social distancing really means that as much as possible, we need to live out our normal daily lives, but at a greater distance from one another. So the policy says we all need to still go to work. But going to work, working at the office, or going home, we need to practice some kind of social distancing to avoid exposure to the virus. Okay, so that's another challenge. The third one, of course, is if that still fails and there will be some kind of development of some clusters of infection, then maybe there could be more specific, more stringent kinds of smaller community quarantines that are stricter to ensure that those clusters don't grow even further. So I think when you look at most of the provisions in this, it's really focused on slowing the spread.
You mentioned, Professor, that we can look up to other countries in terms of how they did their spread prevention initiatives, just like in China. So, and you also mentioned that when they started doing that, they infused in additional resources to beef up the other leg of addressing the problem.
Yeah, I think the difference is like when you look at some parts of China, when they actually did a lockdown, they really stopped everything. It was a hard stop, even among offices, etc. So I would say that what we have right now, maybe not, it's probably based on my interpretation of the tone and the explanation, it does not seem to be as hard a stop as I think what we observed, what happened in China in relation to their own lockdown. So I would say that maybe because they have a greater capability and they have greater resources, they can afford to really shut it
Tell
down
people to stay in their homes and not
to
actually go
support
into-
them with resources. Here, because maybe we have different capabilities, we need people to behave in a way that will ensure public health and public safety, like keeping distance from one another. But at the same time, we need people to continue to go to work so that companies may still operate, because we don't have the resources to actually literally physically shut things down. So this is kind of the area where there's some kind of pain point now, right?
Especially since Metro Manila is undoubtedly the business capital of the country. So when things slow down in this particular area, it's going to have a
Yeah.
ripple effect.
So this is the wicked problem related to, one of the wicked problems related to overcoming COVID-19. The reality is public health demands that people behave in a way that does not increase the spread of the virus. That's clear. But on the other side, the issue is that these behaviors that prevent the spread of the virus are not necessarily aligned with the behaviors that employers need from their employees so that they can be productive at work, so that the businesses can continue and not collapse or go bankrupt, which is bad for the economy as well. So the challenge really is how can we maybe adjust the business models of many companies or many types of industries so that these two things are more aligned, right? It's the alignment between the good behavior that will not spread the virus, but behavior also that is
Sustain the business.
that will sustain the business, right? And right now, I think a lot of the opposition or a lot of the complaints against the provisions that were presented is basically along the lines of that conflict, right? That yes, we understand people need to stay away from one another and they need to protect themselves from the virus, but a great number of people in Metro Manila are reliant on showing up physically at work and interacting with people, and they don't have the savings nor the resources to actually work from home
or stay
or
in their places and not going to
Yeah.
the office for a prolonged period of time.
So actually, for me, that's one big area right away where a lot of innovation can happen, right? Number one is that there really is a need for businesses to adjust the way they do business so that they're more aligned with both the requirements of the business and the requirements of public health. But at the same time, I think, because not all businesses will survive for sure.
Ouch.
There will be businesses that will fail because they simply won't survive the disruption caused by this community quarantine. So, there will be a need to provide employment to people who will lose their
Or
jobs.
because of what you mentioned about the possibility of some businesses not surviving, maybe it's also a time to look at alternatives.
Yes, because obviously there are new opportunities that are coming out. So there's a new set of industries that need to be considered, given that there are unique needs now that did not exist before the quarantine. Okay, so I mean, one example for me would be, I think the senior part of our population needs a higher level of protection and they need a higher level of service. So I think that there's going to be a lot of people needed to do a lot of the tasks that seniors used to do, but maybe because now they're trying to avoid exposure to the virus, they need some help. Okay, so that could be things such as, going to the grocery,
A personal shopper.
personal shopper, or getting medicine, or doing errands. Okay, so I would invest more time to talk to more seniors to understand more deeply what their needs are, and then maybe we can leverage existing platforms, existing digital platforms where seniors can order services, and maybe there's an opportunity to hire more people in that space. I think the other big opportunity, of course, is that we really need to ensure that the environment is safe, clean, disinfected. We need to make sure that we're tracking down all of the potential people under observation, etc. So I think there's again a big need to strengthen the service side of managing the virus. Okay, whether it's tracking down people, or investigating people, or testing people, and so on and so forth. I think there's again a need to reconsider the amount of new products and new services needed by that part of the population. So all I'm just trying to say is that as these new constraints or as these new rules are put into place, there's always going to be some businesses that will be negatively affected, but there's always going to be new opportunities for new businesses to come in. I know that there are many agencies, and because some people have asked me directly, there are a lot of agencies who are looking for local counterparts to help develop services that will help people affected negatively by the current lockdown. So we just need to be agile.
And I guess to drive home that point, innovative thinking right now. You mentioned something about looking at the existing business models and making changes to it. Unfortunately, some people might not be too quick.
Well, I'll give you an example, okay? I've been working with the fintech industry for a long time. And, there's always a number that's being thrown out. Around 75% of people are unbanked. Unbanked, okay? Meaning they don't own a financial instrument, a financial product today. Only about 25% of the population has a financial product, whether it's a savings account or a credit card or something, okay? So the biggest mission that all fintech startups espouse is they want to reach out to the 75% unbanked, okay? So, knowing that, spending so many years working with many of them, and then looking at the situation now, I'm sure that there is an opportunity to look at it through a fintech point of view and trying to ask ourselves, are there new features that we can put inside our fintech products that could be the features that will attract those who are currently unbanked to now get and download some of this fintech and register as customers to this fintech, because there are certain features that will help these people cope through the crisis that is being created by COVID-19. So I think, all of the current development opportunities that we have, everything described by SDG, it can be seen through the eyes of COVID-19, and we can ask ourselves, how can we reframe some of these opportunities to include the COVID-19 context to help me figure out how to develop new products and services to address some of these. Because I'm sure, other issues such as responsible consumption, everything else in relation to how this virus started and how this virus spreads can be addressed by some of these new innovations.
Right. Okay, so I would just like to go to one of the slides that we have prepared about how to look at the COVID-19 problem in the Philippines in terms of the resilience framework.
Okay, so so we have here a 4-stage resilience framework. Okay, so for those of you who are interested, this resilience framework was developed by the UK government. Okay, so they have a department there called the Department for International Development. So this framework was created, I think, maybe about 10 years ago. So it's called the 4-stage resiliency framework. So if you look at it from left to right, okay, so we're using this framework to help us understand what's happening today. So the first question is, so what is the context? Which social group are we talking about? Which region or which institution? Okay, so
So in
basically,
the case of the COVID-19, that would be NCR.
so for this particular conversation, in relation to what was announced last night, which was the community quarantine of NCR. So of course, COVID-19 is a pandemic. Okay, so we're not talking about COVID-19 right at the moment as a pandemic issue. We're really talking about how do we understand the announcement last night in the Philippines in relation to the community quarantine of Metro Manila. So the context for this discussion is basically the National Capital Region of the Philippines in 2020. Okay, so this includes everything: the demographics, the economic structure, the political structure, the social structure, etc. Okay, and I would say, some of the most important factors here is that, number one, NCR constitutes about 40% of the whole Philippine economy, roughly. Maybe slightly less than 40%. Also, it has fairly high levels of income inequality.
Okay, yep.
So there's a lot of people who are very well off, but at the same time, there's also a lot of people that are really living day to day. Okay, so the means and the resources available to the population of NCR is not equal. It's not equitable. Okay.
It's also the seat of governance. So
It's also the seat of governance. So this is where most of the political institutions are located, etc. Okay. It's also the number one port of entry from air travel point of view, etc. So there's a lot of factors that we can study about NCR in 2020. So it has its strengths, it has its weaknesses. Okay, and we're trying to understand it in the context of a particular disturbance. Okay, so normally disturbances we try to classify it into two: some kind of shock or stress.
just to take a pause there.
Yep.
So for the academics out there who's trying to make a sense of the framework, you start this analysis of the disaster by trying to understand a particular specific area.
Yes.
Okay, got it. That's
So-
the context.
So that's the context. Okay, so of course the title of our talk is Innovative Thinking to Overcome COVID-19. So that really can be described or discussed in many different contexts. Okay, the Chinese context, a South Korean
Or the global
context, a
context.
global context, or a future context. Okay, so for this particular one, it's the NCR, National Capital Region 2020 context. Okay. And the disturbance is basically a stress. Okay, so the reason why we consider it a stress is because this has been around for several weeks already. So this is not a shock. This is not completely unexpected. Actually, it's COVID-19 because it really started in 2019. So it's already
And you
March.
call it a stress because it's creating some problems for
Yes,
the systems.
and it's been stressing the system already for several weeks. Okay, so I think the first case was sometime late January.
I don't remember the date, but immediately after the Taal volcano
Yes,
eruption,
yes,
we had
yes.
some experiences with that.
Yes. So
Although the complexity there is, for the most part, we just had the 3 confirmed cases,
Yes.
and then 1 fatality,
Yes.
and then there was a lull.
yes, I think that's really the issue when it comes to these kinds of disturbances, the stress type of disturbances, right? Because it's really a question of, is the impact sufficient to justify a change or an adaptation? Okay, so at an earlier level, of course, it would have been more beneficial if we ramped up capability sooner,
Early on.
or if we may be isolated sooner. But then the real question is, but politically, in the community, would it have been justifiable or acceptable for people to accept maybe government making a decision
Right.
a little too early?
So to put that in more specific terms, if we were faced with just 3 confirmed cases and the government automatically mandated the shutdown of the metro, the public will probably not be on board.
Because I think the public would say that the cost of doing it at that time, from that perspective, would outweigh the benefit of doing it.
Okay.
So, but that's really the problem, right? Because which mistake would you rather make? Would you rather be too early or too late?
Or
Honestly,
overly cautious,
I believe that
or-
the Philippine government today believes that they're still early. So they believe that,
Especially in the context of what happened in Italy.
yeah, I mean, so when you compare it to like Iran or Italy or even the United States maybe, I'm sure the government perceives itself to be still early. Although I think this is all relative because
Because you can also say that China was also too late to draw their efforts when the initial stories that came out were not as impressive.
yeah. So I mean, if you know the saying that necessity is the mother of all innovation, then the question is, when does the population of NCR believe that it's now a necessity
Now,
to do it?
our discussion before the live streaming, just to put it out there, the quarantine, the community quarantine is a necessary thing to do.
Yes, I think it's necessary. The cost of not doing it is right now, or maybe before it was unimaginable, but now that if you've been listening to what's been coming out of Italy or what's been coming out of different parts of Iran or China, that I think that, the need to change behavior now and to disrupt the economy now might have a smaller, lesser impact
Compared to a too late.
then
Actually.
if we wait a little bit longer. And so that's really the dilemma, right? The dilemma is it too late, too soon, too much, too little? Okay, so I would suppose that the problem on hindsight, too little, too late is the worst. On hindsight. Okay, so right now we would rather be too early and too drastic.
And that's a problem with hindsight. You only get to look
To know
at
it
it
eventually, right?
after.
Yeah.
Okay.
So the question is, do people believe that this is the right time, and is it drastic enough? Okay, so I know that there are some people who don't believe it's sufficient, and there
Or
are
some people also
who,
the reverse.
who believe that it's too much.
Okay. So to go back to that framework, the stress is this current coronavirus that's a global pandemic impacting, I don't know the population right now, more than
Around
about
12 million,
20
12
million
million,
in
yeah.
Metro Manila. And then the next part of the framework,
So the next part of the framework really is understanding initially, and then designing new ways for the system to deal with the disturbance. New resources, new capabilities, new capacities, etc. And the way I understand it, so this is my interpretation, the way I understand it is, why do we need to slow down, or why do we need social distancing?
the ones that they prescribe. So the suspension of classes, land, air, sea travel from Metro Manila.
Flexible working.
Flexible working.
Okay.
So these are all
For me, these are all activities that will lead to less exposure to the virus, which the outcome, of course, is fewer infections, or to slow down the rate of infections, or as popularly known today, flattening of the curve. Okay, so a lot of these activities are about slowing down the infection. Okay, but I also believe that part of the strategy to deal with the disturbance has to be about being able to clearly identify who is actually infected as early and as fast as possible, so that these people can be separated
from the healthier part.
from the healthier part of the
To
population.
clarify, you're saying reducing people's exposure to the virus is
One pillar, but not sufficient.
not enough.
Not enough.
Okay, so the other one would be
The other one would have to really be the medical community providing the capability to test the presence of the virus with people, and then to really physically separate them so that the infection rate drops, and so that the overall rate of infection drops faster, because we're able to identify these patients in a more efficient way. Okay, so all I'm trying to say is that the big part of our adaptive capacity right now that's missing because it's a new virus is testing. And then, of course, eventually, whatever kind of treatment that can mitigate the secondary effects of being infected by the virus, like pneumonia, etc. And then, of course, maybe in the future, hopefully in the future, some vaccine. Okay, so I mean, obviously, once you have vaccines that really are effective, then people will really not be worried about the exposure.
Right, and the next time that we get into this virus, people will not really think of too much about it.
Hopefully,
If there's a vaccine.
yeah. So, but the reality is we're still far off. There's still some time before we actually have a vaccine. So the challenge for the whole world is to buy some time and to keep the infection rate within manageable levels, but at the same time investing in new science and new technology and new capabilities to take care of the population.
Prof,
So,
can
yeah.
I just ask you to say that very clearly, because I think that's one of the things that the public probably are not contemplating when they first initially heard about the government efforts. Again, some people feel it's too much, some people feel it's too little, but the logic behind it, as you explained to me while preparing for this live stream, made absolute sense to me. And perhaps the general people can also see it from that perspective about supply and demand.
Well, I mean, if you use supply and demand as the analogy, basically what happens is that when you get infected by the virus, suddenly you demand some kinds of, medical services and care. And the problem is that because we're not necessarily aware of how many people are actually infected, and we're not aware how they should be treated, and because it's very infectious, that the big problem really is if the numbers shoot up too much beyond the current supply and overwhelms the supply and maybe cripples the medical system, then we will lose all ability to manage the situation. So we have to make sure that the demand, meaning the infection rate,
For the medical care,
is growing at a slower rate than the growth in our ability to grow the testing and the quarantine and the treatment and the care on the supply side, basically. So right now, we have to figure out a more innovative way to grow supply faster, to have more effective products and services so that we can treat all people who get infected by the virus in a very humane, dignified, efficient, effective way. Okay, and right now, it's not in our favor, right? Right now, we're afraid that the demand is going to outstrip the supply, and therefore the need. And, the cost of that is going to be the cost of our system getting overwhelmed by the disease is really, and you can already see it in the stock market, how much
the cost in trying to catch up to that, but also the
cost of not being able to manage the virus is very high.
Right. So again, the way that my understanding of Prof. Cruz' explanation about the necessity for the quarantine is just to make sure it's not the cure. This is not.
I don't think social distancing is the cure to the virus,
it's not
right?
the cure to the virus, but it's an attempt to slow down the spread so that we are able, the medical community can start to prepare and because like what Professor Vinod Thomas mentioned in the other live streaming, there are only so much hospital beds to one Filipino. There are only so much. There's only one doctor for 30 plus. I forgot the data that she shared with us. But clearly, if the system gets overloaded with the influx of patients who are positive with COVID-19, the system won't be able to care for it, and then you have a bigger collapse of the country.
So, I mean, I just want to say, and congratulate UP, NIH, for the development of the testing kit, and actually I posted about it on social media earlier today, and I'm very happy that we've been able to create a kit that's cheaper. Okay, so that's important. I don't know though. I haven't learned enough about the kit to know whether is it faster than the kit that was given to us from Australia. Is it easier to administer? Does it require a lot of technical skill to administer? Of course, I think the ideal test solution would be the easiest to administer, that will give you the fastest and most accurate results at the lowest possible cost. So, you know, although I'm very happy that we're able to develop an effective test kit, and it's, I think, right now going through the process of being vetted by FDA, I'm sure that by allocating more R&D resources towards that kind of kit will further improve the overall effectiveness of that kit. That's one, I think. So, you know, there's a lot of scientific and more medical research that has to go into creating that kit. But you know, assuming that the kit is available and we're able to scale the manufacture of these kits to a much higher level, then the next question becomes, who will administer the kits? Who will train the people who will administer the kits? Where will it be administered? How many centers will we have? Where will these centers be? Will it be as innovative as the drive-through that they did in South Korea? I think my understanding is they don't want to do the testing in the hospitals because they're trying to make sure that the hospitals are reserved only for those who are really confirmed to have the disease. So again, there's a need to scale up facilities where these tests can be made, etc. So there's a lot of opportunities, and I think there's a lot of innovation sort of projects that can be done within the delivery of medical services, not just the testing kit, but everything. Even, you know, I got a message from other students, the PPE, the personal protective equipment, and, you know, even from a service design point of view, an experience design point of view, I think there's a great need for design thinkers to come in and figure out a way to make sure that the experience of getting testing is a positive experience, so that more people will be encouraged to go and take the test, so that I think the more people that take the test, the easier it is for us to manage the outbreak.
Okay, so to wrap up this framework, you talked about context, disturbance, capacity. The last leg would be reaction to disturbance, which we talked about earlier on. Bounce back better, bounce back, recover but worse than before, or collapse. So, for example, what you were saying, if the need for medical care surpasses what we are able to provide because we are not able to contain the spread of the virus, then the collapse is a very real possibility.
But I would rather focus on the bounce back better,
Right,
because for me, what I see, for example, are things like this. Number one, my son was just telling me in the car earlier, don't you think that people will realize because of COVID-19 that we can actually be very productive at work from home, or we can actually be very avid learners at home? And I think the reality is...
how old is your son?
He's 20. He's already in college.
Okay.
So, but I guess the idea here is that I think a lot of the labor practices, a lot of the way the work has been designed to cope with this will probably last beyond
this particular situation.
Yeah. I think work from home is going to become
The way of the future.
the norm, and you know, its impact on traffic,
Yeah.
and the reduction in traffic, and maybe the boost in productivity.
And the use, probably reduction also in the other overhead expenses you get when you have a physical office.
Yeah, and maybe it allows us to free up more space for other uses, etc. So, you know, the systematic impact of what innovations will happen during this pandemic will have long-lasting impact
Beyond what we're facing right now.
Yeah. So actually, COVID-19 is forever going to be with us. All of the innovations that will happen now will be permanent, almost permanent features.
There was a presentation you shared to the class where you mentioned something about the tipping point, where after the tipping point, things start to improve.
Yeah, I think, you know, I mean, just here at AIM, right? This debate between having classes face-to-face versus online or blended. I mean, we've been having that debate for a long time. You can argue that we ourselves were in that rigidity zone where it was very difficult to decide one way or the other what it would be. But I think an event like this today
Moves you to that.
doesn't give us a choice anymore, right? It breaks the rigidity trap, and then it forces us to consider the new innovation. Okay. So I mean, and I believe that's true for most organizations right now. That whatever fears they had about changing it's been taken away from them. They don't have a choice. They have to change.
They have to change.
They have to change. So actually, there's no other real long-term pragmatic choice except to think in a more innovative way.
Right, and to some people, it might really mean what you mentioned earlier, which is quite disturbing if you think about it. Some businesses might not survive this. So the prudent, resilient approach would be think about maybe looking at alternative business
Yeah,
where
I
you
think-
can go into.
I mean, if you look at the fundamentals of the economy, the population is still growing, consumption is still growing. The challenge, though, is whether your product category is still relevant or not relevant in the context of the new environment, like in a new COVID-19 environment. Okay, so I mean, so thank you for making this slide.
Just to hype the point of our topic for today.
So I think now more than ever, okay, we've been talking about this for a long time, but I would say now, today more than ever, there's really a need to have people lead real innovations, whether they are policy innovations, whether they are product and service innovations, whether they're business model innovations, technology innovations, experience innovations, conceptual innovations like how we think, how we feel, how we work, how we discourse. Those opportunities exist, and they have to be focused on solving one of these two problems right now, at least in the very, very short term.
Question, Prof. Does it matter if it's a small innovation or a big innovation? Will that have any...
I think, small innovations.
Like, for example, slight changes to the way you've been doing things. For example, what you mentioned about AIM. Before, it's all about actual physical classroom instructions. Now, moving towards online. That's a big innovation.
Yeah. No, I think we will know in the next few weeks how we're able to also adjust. I think that's the mantra of everybody today, that we need to adjust and be agile. And we need to learn new skills and reconfigure the way we do things. So no matter how small it might seem now, the potential for it to be very significant in the future is there. Okay, so of course we're focused on the problem now, and we're trying to minimize the number of people who will be casualties to this virus. We're trying to minimize the suffering associated with people getting infected by the virus and all of that. So that's our priority now. But looking beyond that, we will benefit from all of the innovations today in a post-COVID-19 world, and how the quality of life will be after that hopefully will be better.
Okay. So to wrap up our discussions about the particular
Yeah.
situation we find
So
ourselves in for Metro Manila.
yeah. Go ahead. Yeah.
No, so basically what we're saying, what Professor Cruz has explained to me and what we try to share with you is the attempt to distance people from one another, get people to stay at home if they're not, if there's the gatherings are not that critical, stop going into them. Managing travel to and from Metro Manila is all an attempt to slow down the spread of the virus. But again, as Professor was mentioning, there are other innovations that we could look into how to prevent the virus from spreading. And it takes a lot of contemplation and probably strategic thinking to get that.
Maybe we'll have a succeeding session just
on
talking
this.
about what kinds of specific innovations can happen here, because I can think of so many. Like, our homes should be designed differently, right? The kinds of rooms we should have in our home should be different.
Right.
The kinds of appliances that we should have, or the kinds of furniture that we should have, is probably going to be different if we're going to be spending more time at home and so on and so forth. So
that is also that's also a disturbing thought. There's also the possibility that this quarantine might stretch more than a month, right?
yeah, I mean,
So-
we don't know, right?
So maybe again, to your point, the redesign of our living quarters might also be something to look into. moving
Yeah, and I'm
forward.
sure even from a developer point of view, like how condominiums will be developed in the future or how malls will be designed in the future. I mean, all of these physical spaces and how they will be designed and what we put in those physical spaces, they will have to be innovated and reimagined, because I don't think we're ever going to look at the mall the same way, and we're never going to look
Right.
at the condominium the same way. We're now going to have different expectations of what should be there and what
Right.
shouldn't be there.
Because it's crazy if we don't learn from the experience that we're
Oh,
going
it is.
through.
Although we don't always learn, but it doesn't make it less crazy. Yeah, it's
Okay,
just crazy.
so the other side of that is ramping up our capacity to test, treat, care for all those infected. Great that we have the development from UPNIH, but that is just one of the activities on the other side of addressing this pandemic in the
Yeah,
Philippines.
I mean, honestly, I would say, I mean, this is not just the technological innovation. Right? I mean, you remember recently there was this conversation that we should reinstate ROTC. For all we know, the national service that young people should be giving is not military service, but it could be paramedical kind of service. So, you know, I mean, ROTC, I think the outcome is a good outcome. Like, we want people to be more committed to the country and to provide service, but maybe how they plan to do it is not like the best way or the most relevant way. Maybe moving forward, everybody should either be a reservist in the military or a reservist care provider in some part of the medical system or the care system. So, you know, I mean, if we just spend time to reimagine how the resources can be deployed, we can really ramp this up quickly. Yeah.
And it doesn't really require, well, again, if we're able to manage the spread, then the consequence would be better management of those who are actually affected, because
Yeah.
they're not that big in number.
Yep.
Okay, so I think we still have one more there. This is to share with you why we did this special episode of the EMDRCM Live. Late last night, our very good professor was very passionate in about trying to make an impact amidst all of the scare and the panic that's been created by the announcement from the government. And seeing all of the posts online on social media, how people were reacting, Professor Cruz shared with us an idea of why not mobilizing these creative energies from everybody, whether they hate the lockdown, they agree with the lockdown, they're neutral about it. Why not collect all of these things and get everybody to be at least moving towards that direction, overcoming COVID-19. So this episode is actually because of Professor Cruz. So maybe you can also come to us and explain to us why we're trying to do this.
Yeah, I think, you know, I've been very blessed to have been in AIM for more than 20 plus years already. And I've had the very great opportunity to work with many different kinds of organizations and companies. And I know for a fact that there are so many capabilities and resources that exist in different organizations, groups, LGUs across. And I think we can really create new ways of doing things, new innovations, if more people came together and collaborated with one another, share their resources, share their capabilities, and, you know, create all these new products and services. And, you know, I mean, we're a business school, so I also believe that this is an economy. This is a business also. Government is there also to be the provider of these services. Government needs help from private sector. So, you know, we have to leverage the way the system is designed so that we can cope. So, but it won't happen if it's only government. And it won't happen if it's only private sector. There really is a need to bring all of these different points of view and capabilities and resources together. So that's why we spent like 20 minutes deciding what word we were going to use. And the word we decided on was, let's join forces, okay? So many people have forces that try to join the different forces together so that we can do something really impactful while COVID-19 is a big threat to us.
Okay, so one interesting thing that we're trying to achieve is to also keep the conversation moving. So if you do decide, please do share your innovative ideas on how to live with the community quarantine, the travel restrictions, all of these
There
things.
should be a lot of startup ideas. Okay, so we would
Although not just on the business side, there might be some innovative ideas in what you were explaining, social enterprise or from the government service sector. So if you, just like all of us, feel passionate about mobilizing our collective energy towards overcoming this and becoming more resilient, please do share with us. We are going to spend some time next week in another live stream with Prof. Cruz, of course, to talk about some of these ideas. And if we get some of the great ones, we can probably invite you to come over, or maybe through Skype, to maintain the social distance and tell us more about those great ideas that you have about living with COVID-19. So last word, Professor Cruz?
I just want to say that, I think maybe we should show the other slide. This is our biggest challenge. For many of us, in our lifetimes, we probably never faced, as a metropolis, this kind of challenge. So I think it's normal to be anxious and afraid and scared. But my hope is that people have a lot of empathy towards one another, and we really understand that it's not easy for everybody to cope with the uncertainty, and that hopefully, while we're in this crisis, that we will really prioritize taking care of one another, and maybe later on figuring out how we can grow the economy further. Okay, so stay hopeful, channel all of your creative energy to becoming a better version of yourself, and then making a contribution to any innovation that can help our community.
Right.
Okay, so yeah, thank you.
Thank you, everybody, and keep on conversing with other people to talk about how we can move forward and become more resilient as a community. Stay safe.